We have a question, Dr. Adams, that's coming from the public. Is the COVID shot effective for cancer patients, and is it safe for them to take?
So great question. And I'm going to broaden that lens a little bit because there's cancer patients. I've asked that question about immunocompromised patients in other ways. I've been asked that question about women who are thinking about becoming pregnant. What I want you to know is when we do a trial, we start off working with healthy people, and we want to make sure it's safe in them, and then we move to other populations. These trials have, in fact, included people in them who have cancer, who have diabetes, who have high blood pressure. They were first shown to be safe in healthy people, and then we expanded them to include people with comorbidities. Comorbidities is a word we use to say people who have other diseases. And that was important to us because we know that the people who are disproportionately dying from COVID are people who have these comorbidities. So it is safe to get this vaccine if you have cancer or if you're immunocompromised, because again, we aren't giving you the virus. We're just giving you a protein and letting your body's own immune system work. It's actually incredibly important if you have one of these comorbidities to be willing to get the vaccine, because you are at higher risk for hospitalization and death if you get COVID-19. For women, I do want to say, because this is a common question that I'm getting, that there were not pregnant women intentionally enrolled in these trials, but there were women who became pregnant during these trials and women who breastfed during these trials. And again, because we're not actually giving you virus, scientifically, we feel that it is safe to give to pregnant women based on what we know right now. And more women will be intentionally enrolled in these trials who are pregnant moving forward, because now we know it's safe in healthy people and non-pregnant people. And we're starting to do more studies in pregnant women. But I would say you should talk to your health provider if you're in any group and you have questions. Don't let misinformation or fear cause you to make a decision which could negatively impact your health. And remember that in many cases, these groups of people who I'm talking about, pregnant women, cancer patients, immunocompromised patients, are at higher risk of dying from COVID. So there's a good chance your healthcare provider is going to say to you that in your own individual situation, they feel the risk of the vaccine is much lower than your risk of getting COVID with this new surge going on. So I don't want to give anyone any individual health advice, but I do want to say in general, we feel like it is safe for these groups. And specifically, you should talk to your health provider if you have further questions.